Here's the problem. How do you design a hospital with innovations that will grow with the future in an aesthetic that feels warm, fun, even recreational, and less clinical, but with all the benefits and best medical technology available? And how do you do so without breaking the systems that keep it all running?
Standardize where we can and customize where we must.
Earlier this year in February, at the Healthcare Systems Process Improvement Conference, we got the chance to step inside one of the most advanced pediatric hospitals in the country, Arthur M. Blank Hospital, Children's Healthcare of Atlanta. Here we spent time in a massive 19-story, 2 million square foot facility where advanced technology is used in ways that support staff and therefore benefit the patients.
A patient who was they were going to take them off life support, and the parent was unable to be there. So we were able to use the technology to connect the parent to the child to say goodbye to his child before they were removed from life support. So to me, that's my why and what really made an impact.
Join us on this episode of Problem Solved. Walking into the lobby of Children's, this doesn't feel like a hospital. There are large windows, a lot of space, a lot of light, families, and games. In the lobby, there is a large interactive wall where motion tracking sensors allow you to make the animals on the wall move, leap, or fly. Our group of professional engineers immediately started playing with this.
You can walk around, you can move around, you can jump, you can do stuff. Come on, entertain us.
And we're told about Ryan Seacrest Studios, where musical artists come perform for the kids, and there's a wall of celebrity autographed photos like Justin Bieber. We were led on our tours by Kristen Bowman and Felicia Reinders.
We have video games they come down and play. We have miniature golf. We have basketball. We have soccer nets that they can play, cornhole. So they can just come down and be a kid and not have to worry about being in the hospital.
It's joyful and it's bright. It's not accidental, it's engineered. Children's has some of the most advanced technology in clinical care, but before anything reaches the patient, it gets tested here, in the simulation lab. This is Megan DeFury, one of the simulation lab coordinators.
It's been like a labor of love creating this space. We've been working on it since like 2020. And so our goal in creating this space was, why not replicate what you see in the actual patient care rooms here? And so this has been really beneficial because we have an OR right there. I'll show it to you guys. The trauma center, ICU, and GPC rooms, as well as an ED skills room.
In this space, they're not just testing clinical skills, they're testing entire systems. And they do so in an environment that mirrors real patient care as closely as possible. Clinicians notice gaps, especially around human factors and ergonomics, that weren't being captured in traditional simulations, so they built a space that could.
Our bread and butter really is looking at process improvement. So evaluating, using simulation, existing or new processes within the system. We can look at new or existing processes before they go live. What the simulation coordinators typically do, we plan it from start to finish. We can do a tabletop exercise, making sure everyone's on the same page, bringing all the players in. So interdisciplinary, everyone sometimes has their own thoughts on the process. We'll run through that simulation. We identify latent safety threats or any areas of opportunity that could impact our patient safety, impact our staff workflow and efficiency, because we know that's like super important, especially during those high risk, high stake situations. What we have found, we recently started doing, and I really enjoyed it, is we do action planning afterwards.
It was very clear the level of detail that was put into the space and how important it is to training.
You can see like the booms will move. You guys are welcome to walk around, play, touch, whatever. You're not going to break anything here, because that's the point of simulation, to be able to practice. But you can see these booms. We can actually rotate the room. We can rotate the bed space. We're like, whatever the OR is receiving, we want to try to replicate that. Or how can we get the same footprint?
Yeah.
So that was really the goal, even all the way down to the circle in the room, because a lot of clinicians, at least I know this from my time at the bedside, a lot of us will orient our positionings during like emergencies or procedures based off the circle.
Yeah.
Then we move into another room, set up with X-ray imaging, intubation equipment, and everything needed to support a level 1 massive transfusion protocol.
I actually just did some training on Monday in here for a role that's called a CPR coach. It's like an AHA standard to have this role that will actually help the provider take off some of the cognitive load. And we're implementing the ED right now, so we were able to work on a lot of ergonomics with the actual new role and how that looks within the emergency department.
In this simulation lab and throughout the entire hospital, technology is everywhere, not to replace people, but to support them. Interpreter services are integrated into care, information flows smoother, decisions happen faster, and staff can stay focused on the patient. And in a space this big, where providers are covering more distance than ever, that kind of support makes a real difference. This is Michelle Tillis, CNIO and Vice President of Information Systems and Technology, and Jason Skelley, Director of Information Systems and Business Partnership.
All of the visualization that we helped to enable with just being able to see where my team member is if they're in the other room. Obviously, when we think about the cameras and just the possibilities, we were only scratching the surface. And I think that it's really put us in a great position to reimagine what healthcare looks like, and as we have kind of the demands and competition of resources and challenges in staffing, I think that we've got a really great opportunity to help improve that just with the technologies.
We deployed virtual nursing in a pilot program, making sure the technology works, understanding how staff would use it, having people come in and portray as patients and their family members or the actual patient. And it really helped us to figure out, here's some opportunities to improve this process from the patient standpoint and how the technology is used.
I was curious about the telehealth. With the virtual nursing, was that hard to make that still feel personal to the families? Was that one of the concerns that you had to overcome?
To date, I think the numbers play out that the patients have appreciated the virtual nurse and what they bring to the table with the admission and the discharge tasks that they handle. And I think it also helps that we're piloting our GPC unit. The virtual nurses are also serving as, when they're not in the virtual nurse role, they're serving as a bedside nurse on the GPC. So they can, because they work there every day, they can give that more personal aspect as well.
And Atlanta's such a diverse place. I mean, just the language barriers that might be.
Well, that's the other benefit too. I think that what we've seen so far, at least because we're only on month 3 of the virtual nursing pilot, and we've surveyed the staff, both the bedside staff and the virtual nurses, and we're obviously surveying our patients if they choose to respond. But what we've seen is that it has been a really great facilitator with patients that have a language barrier, because you're able to engage the interpreter services on the call, and it really helps to facilitate that and take that off of the bedside nurse. But again, they're just another member of the care team, so we've just really kind of expanded what the care model looks like for nursing on that floor.
Technology is used on an even more personal level.
We did have a really great story, I feel like, that was really touching about it was a patient who was they were going to take them off life support, and the parent was unable to be there. So we were able to use the technology to connect the parent to the child to say goodbye to his child before they were removed from life support. So to me, that's my why and what really made an impact.
Yes.
Last year, Children's treated more than 5,000 trauma cases and cared for over 90,000 kids. Behind the scenes, systems are in place for the moments you hope never happen. They're one of just 13 regional emerging special pathogen treatment centers in the country, equipped to care for pediatric patients with diseases like Ebola or other novel respiratory threats. Teams train regularly with full-scale PPE exercises, preparing for scenarios they've thankfully not had to activate yet. Again, we pass through the lobby, a chapel, and hear about special events and activities that are always available.
A lot of times we have a lot of donors that come in and they want to do patient parties. So at Christmas time, Ace Hardware donated 500 metallic trees. Every patient that was in the hospital received a tree with ornaments, lights. Then we had someone provide a hot cocoa bar. So it's just an area that a lot of patient parties happen down in here.
And then we got to the robots. If you want to see industrial and systems engineers light up, show them about 90 robots delivering medication, meals, and other supplies. We entered a large warehouse space. Beeps echo off the cement walls and floor.
So this is the hub, right? Down the cars, you'll see some robots parked over there. We have 90 robots in total, 3 different types. Backup house ones are called T3XLs. They're a little bit bigger. You'll know them because they're white. They are not skinned. You notice the food services, that's a T3. It was skinned like an ambulance. We have 27 of those, and we have 33 Xenas for pharmacy and lab. We got trash, supply chain, dirty meal carts, regulated medical waste, linens, and supply chain.
Robots move autonomously, guided on their own path, parking themselves, moving to their elevator, waiting patiently to get on and then off. And even here, the most important thing isn't the technology, it's the process.
Watch that here. Oh, that is a food delivery cart. So the kitchen, meals come into the kitchen. They have 16 minutes to get the meals made and up to their destination on a patient floor. So they put the meals, it's gonna come that way, it's gonna go through y'all. So they put the meals in the cart, select the destination on their iPad in their location, and it goes up carts, and a food services team member removes the meal trays from the cart and delivers them to the room. These are mapped via software to get to their locations, right? So every delivery stop, every path was mapped. And then a team member, you can see the UIs on the pillar over there. Team member will come over and say, I need a small trash cart sent up to the 15th floor, and whatever robot's up next does it. Working here, he has a good question about the elevators. They are AMR specific. They were worked into the plan from the beginning. We decided on those before we even knew what robots we were going to have. So there are 12 robot dedicated elevators. All the robots would get off when they come down with dirty linens or empty supply carts or trash. They would all come out those elevators, follow these tracks down to the intersection at the far end of the wall, at the far end of the hallway. Huge bottleneck because they're sitting there waiting for other robots to cross their paths. While they move kind of fast, they're not the speediest things, so we would see a significant backup. So one of the things we did, we're trying to figure out what's going down there, why does it need to. Just basically walking the space, we figured out linen carts and trash carts have no reason to go down there. They can, because they're not employees, right? We don't care how many steps they get. We don't care if they're tired, they're gonna run. We could instead send them on a longer, slightly longer path that's just one way around the building, and they never interact with that junction down there. So the robots now turn right, go all the way down this hallway, turn left again to get to where they're going. And then they come back this way. Huge time savings, significant improvement in their performance, significant reduction in traffic jams. Because if one robot gets backed up, they all get backed up because they're not smart enough yet to navigate around if there's a problem. Biggest bottleneck for the robots is always the elevators. It's always just waiting on their elevator to come up, because once they pick an elevator, they are beholden to that elevator until they finish their job. Right? We're working with the vendor on like some AI to say, hey, this elevator's gonna take a minute, can you jump to the next one that's coming down? Right now that doesn't happen. We came into the robots eyes wide open, really got to utilize, since we're talking about IISC, right, process improvement, a lot of the processes around, right, go meet them where they are, go walk in their shoes, go see how they're utilizing the technology. And it's funny because it seems like we optimize the robots, we work through all these workflows with the pharmacists and food services teams, et cetera, to make them work more effectively for those roles. Mm-hmm. But in the end, if we can get the food up to the floor quicker, if we can get the meds to the patient on time without a staff nurse having to run down to the pharmacy to get medications, we're also helping the patient and their families, right, to be better served by Children's Healthcare of Atlanta.
Yeah.
We spent a lot of time in this space. mostly just watching how these robots move and interact, standing in the path of the robot to see if they would run into one of us. They never did.
Got to check my time because I could talk on these for hours too.
I asked Jason and Michelle about how flexibility, standardization, and customization is balanced in such a large and complex organization.
That's a really broad question.
Yes.
But how do you approach that?
How do we approach it? So I think the best way is standardize where we can and customize where we must, right? Standardization makes things reliable. It sets up clear expectations, alleviates variations, and variables from a process, makes things safer. Whereas customization, while it can be more time consuming, perhaps even more tedious, it does add value that you might not normally get from a system or from a technology.
Yeah.
But it comes with the downfall of then once you customize, you always have to maintain that customization, and how do you manage through that? Is it worth the cost?
Yeah.
Is the value there for that?
Yeah, and I would just say, to add on to it, the way that we go about really determining, how do we walk that line? We do really rely on heavy engagement with the clinical stakeholders. So we try to establish informatics councils and forums where we can have conversations, and we're trying to talk about it at a system level and come to consensus, and then really understand where do we maybe need to make an exception for this clinical area.
Have you ever stopped to think about like how different this space is from hospitals that were like when you grew up?
Oh, yes.
Just the difference there?
Yeah.
I mean, I think about like old movies like Terms of Endearment, like just like what a drag.
It is a hotel-like experience. I feel like Sam shared with us one comment that it was like, it felt like a hotel, like they didn't want to leave. It was a really nice stay, which is not the typical thing that pops into your head when you think about going to a hospital.
Right.
And that was intentional, right? I mean, it's big, it's open, it's bright, the rooms are large, all the rooms are the same size, it doesn't feel sterile.
Right.
I mean, all those design aspects were thought through over the years.
Yeah.
And so that has such a big impact on patient care. How do you think all of that plays into processes?
Ooh, that's a good question.
Well, I do think that it actually presented some challenges for processes with just, we've talked about that vertical movement and how long it takes to get from one floor to the next, and then some of the constraints that we had with the elevator usage. So I do think that there were definitely some process improvement opportunities that we were not perhaps expecting as we transition to this bigger space. So, the last year, the operations team has really kind of been working through how do we solve for that? How do we make improvements? Because the space has now presented challenges that we weren't faced with at a smaller facility.
Actually, that's a really great point, and something that I think our listeners would really be interested in hearing. So do you have some more advice that maybe you can give to healthcare engineers as they're trying to improve, and make spaces both a good healing space for patients, but also be a good place for processes to work smoothly? As they're working to engineer spaces, what advice can you give to them as they're thinking through these issues in the future?
More elevators.
A huge thank you to the entire team at Arthur M. Blank Hospital, Children's Healthcare of Atlanta for giving our group a chance to think about the future of healthcare engineering, building systems that support people in significant moments. And a big hats off to all medical professionals for their skill, hard work, and compassion. Thank you for listening to Problem Solved and being part of these conversations. Every great solution is a story worth telling.